start now. Bismillah ar-Rahman ar-Rahim. This is Abrar Tawfiq, medical technologist, pre-analytical continuous education coordinator, working as a phlebotomist. Today, inshallah, I'm going to talk about general guidelines of phlebotomy. First of all, what's the meaning of phlebotomy? The exact meaning of phlebotomy. There is two meanings of phlebotomy. The first one, in the past, they used to cut the vein and leave the patient to bleed to extract the blood from the bleeding. That's the exact meaning of phlebotomy. Greek word, phlebo and tomy. Tomy means cutting off. Yeah, phlebo means vein.
So cutting the vein.
Yeah, cutting the vein. Phlebo vein and tomy cutting off. Nowadays, we just puncture the vein to extract the blood sample for the analysis. So the exact meaning nowadays is venipuncture, not phlebotomy. Okay? If we start something correctly, we will get high quality results. That's what happened exactly inside the lab or during the blood extraction. If we start correctly, we will get high quality results. But if there is something wrong from the beginning, of course, we will get bad results. Okay? Okay, I have question for you. Does anyone know what happened to the blood sample after extraction? After blood extraction, what happened to the blood sample?
You go through a process. You go through processes.
To send it to the
Lab.
lab. Okay.
Go to the processes.
It goes through 3 different stages or phases. Pre-analytical phase, analytical phase, and post-analytical phase. Before the analysis. Analytical phase during the analysis, and the post-analytical phase after. So the 3 different stages or phases: pre-analytical phase, analytical, and post-analytical phase. So the blood extraction in which phase? The blood extraction in the pre-analytical. Okay. In this lecture, we will talk about the theoretical part of collecting blood samples from the adults, how to collect the blood correctly to get high quality specimen for the lab analysis, and how to prepare the patients and equipment for the blood test, how to select the venipuncture site, and general guidelines for the venipuncture procedure, and finally care of the patient post venipuncture. So what's the meaning of phlebotomy? As I mentioned before, is cutting of the vein.
Before it's cutting, but now it's venipuncture.
Venipuncture, yeah, this is in the past.
Before phlebotomy.
Here are the guidelines of venipuncture. The first step is approach, identify, and prepare the patient. Review the blood test requisition, equipment selection, verify restrictions and sensitivity, perform hand hygiene and wear personal protective equipment, position the patient and apply the tourniquet, skin disinfection, tourniquet reapplication and needle inspection, venipuncture procedure, discard contaminated equipment, specimen labeling, thank the patient, and finally specimen handling and transportation. We're going to talk about them in detail. The first step is patient identification. What's the meaning of patient identification?
Verify the patient.
Yeah.
Correct name, MR number.
Yeah. How can I identify the patient correctly in the inpatient department and in the outpatient department?
You ask the patient his name.
Where?
You ask
Inpatient, we're doing checking the MR number.
The wristband.
The patient
Yeah, of course. But in the outpatient department, by asking the patient to spell their name and the medical record number. Ask, compare the response of the patient, and validate. Never ask the patient, are you Fatima or are you Muhammad?
No,
We should
ask the
we should
is your
ask the
name?
patient. Yeah. And how to prepare the patient to the venipuncture in the inpatient department and in the outpatient department. Usually in the inpatient department, the patient lays down in the bed.
Lying on the bed.
Yeah. And outpatient
Sitting.
sitting. Okay. And the arm should be in a downward position. Why?
Below the heart.
Below the heart, and because of the gravity will accelerate the
blood flow.
the blood flow. So the process of verifying a patient identity is the most important step in specimen collection. Obtaining a specimen from the wrong patient can have fatal consequences. How can a patient identify normally? By ask the patient, compare the response and validate. This is the correct way for identification. And how can a patient be prepared normally in the out and inpatient department? The second step is review blood test requisition. What's this in the screen? This is the barcode. You know all informations in the barcode? The first one is the name of the lab and kind of blood. The medical record number, name of the patient. This is the barcode for scanning inside the lab. And here the name of the test, the name of the person who extracts the blood sample, venous blood, date and time from the staff health clinic. And what's this? Somebody knows what's this number?
Which one?
The tracking number. This is the number of the sample. Only this number for this sample.
That is the
Okay.
last one is for the number of this.
Which one? This is the medical record number.
This is medical record.
Yeah.
The one down is
The one down is the
sample number.
sample number, the tracking number. So cannot be duplicated, this one. Which one? This one in the lab, inside the lab. Okay? The third step, the equipment selection. I think everybody knows what's the equipment I need for the blood extraction. First of all, I need the personal protective equipment. Lab coat, clothes, shoes, gloves, and if I need a gown or something like this. Clean. Sorry?
Yeah, they have to
Yeah, of course, yeah. Clean. Yeah, of course. I have two methods for blood extraction. Close and open system. You know what's the difference between the closed system and open system for blood extraction?
What about this? What is this one? The vacuum?
The vacutainer is closed system. Why we call it closed? Directly from the vein to the tube. And from the syringe, and if we extract the blood by the syringe, we remove it from the vein and then puncture it or transfer it to the tubes. So the clean tray or trolley, this is the holder, different sizes of syringes. This is the closed system and this one open system. Sharp container, tourniquets can be like this or single-use tourniquet like a rubber. Different size of needles or butterflies. Different size, different tubes, alcohol swab, bandages and gauze, and of course request form. The fourth step is verify restrictions and sensitivity. What's the meaning of restrictions and sensitivity?
There are some, like for example, if my patient has, what they call this one, for dialysis, they have this fistula.
Yeah,
They're not allowed to take a blood
yeah,
from
of
this
course.
one.
Yeah.
Any patient.
Mastectomy patient, yeah. The patient needs to be fasting for glucose or lipid profile. It's important to verify that any special diet instructions or restrictions have been followed before we should know before we extract the sample. The most common diet requirements for the patient to fast a certain period of time. The total fasting time is usually 8 to 12. For the blood, how many? For the glucose, how many hours the patient should be? 6 to 8. Okay, and for the cholesterol or lipid profile, 12 to 16. 12 to 16, yeah. 10 if the patient diabetic and cannot wait for more than 10 hours. No, 12 to 16 hours. The patient may have water or should ask, we should ask cholesterol 12 to 16.
According to the new system, I think so they changed the already the cholesterol. They
Regarding if there is only cholesterol, the patient no need to be fast. If it's only cholesterol and high density lipoprotein, no need to fast. But if there is order for lipid profile, the patient should be fasting for 12 to 16 hours. Okay. Fasting also from the water, or the patient should drink water during the fasting. No water.
So is food.
For food, any drinks, but the patient should drink water during the fasting hours to prevent dehydration.
Is it allowed?
Yeah, it's the patient should drink water.
Should drink
Yeah.
this 12 to 16 hours.
Yeah.
Only
And if
for
there is-
cholesterol or all the blood glucose?
For
All-
anything, also
yeah.
also for the glucose, the patient can drink
All the
water.
blood group, you can take
Can drink
water.
water?
Yeah, all of
So,
them.
where people are not taking water.
Because if the patient also didn't get water, will be dehydrated and will affect the results. Okay? If the patient has eaten and the phlebotomist is asked to proceed the collection, it's important to write the patient not fast.
Not fast.
This is the meaning of diet restrictions. Sensitivity, some of the patient has allergy from the latex.
Yeah.
So we should use latex free gloves or tourniquet, non-powder
Please, can you
gloves.
repeat that diet restriction? That is why they can drink the water.
Any patient during the fasting hours can drink water, except in the GTT. But I think in the word you're not doing the GTT, glucose tolerance test.
In the OB,
We are doing.
In the OB, you're doing.
OB doing for the gestational
Yeah.
nutrition.
In the OB, after the patient drink the solution until the procedure finished, the patient cannot drink water because the water will dilute the amount of the sugar.
Yes.
Okay, this is the only test the patient cannot drink water. Yeah. Perform hand hygiene and wear PPE. I think everybody knows the ideal way for hand hygiene and the PPE.
This is ammunition. Ammunition. Look at the ammunition is very-
Palm to palm.
Between fingers.
Interlace. Interlink. Ida. Ida.
Back of fingers.
Link Ida. This one should be like this,
Like this.
not like that.
Who
Ida.
is taking this
Which
one?
one? The last step you
This
mean?
one is like-
Not
Why?
only this one, this should be this is the
Yes.
part that
Okay.
is commonly not being washed. That's
Ah,
why
okay.
this one plus this one, your hands Ida.
The last step you mean? The thumb.
No thumb.
Okay.
That one is.
And rub the wrist, okay.
Because this is
Alas.
laminated.
Using PPE,
I think everybody knows what's the meaning of PPE and
Yes.
okay. Step number 6, position the patient and apply the tourniquet. Regarding to the position of the patient, it depends on if it is the patient in the outpatient or the inpatient department. Okay, I mentioned it before. Apply tourniquet. What's the meaning of tourniquet?
tourniquet.
Tourniquet.
The rubberized that you
Rubberized.
can, what you call this one? To compress the blood.
Yeah.
Yeah, what's the function of the tourniquet?
To hold the blood
The
flow.
like.
Actually, the tourniquet is the rubber that ties in a specific place by specific strength, 3 to 4 inches above the venipuncture site to restrict the venous blood flow without affecting the arterial flow. Okay? This is the place of the tourniquet. Neither too tight nor too loose. If it's too tight, what can cause?
Impeding the arterial blood flow.
can cause hemolysis. And if it's too loose, which will not affect. Okay? So the tourniquet should remain for a maximum of 60 seconds. After 60 seconds, we should remove the tourniquet. And if we need to reapply it again, we can, but after 2 minutes. Okay? So after 60 seconds, we should remove or release the tourniquet. Okay? Where more time is required to find suitable vein, the tourniquet may be released and reapplied after 2 minutes. That's very important point, okay? To prevent heme concentration, accumulation of red blood cells regarding to the plasma, okay? For patient comfort, or if the patient has sensitive skin or dermatitis, apply the tourniquet over cloth. Never apply the tourniquet over an open sore, of course. And disposable gloves should never be used as a tourniquet. When the tourniquet is in place, ask the patient to make.
We are using disposable.
You are using. Never use it because of.
Because this one, the one clip, the 1 inch like that, is not applicable for pediatric.
The big one, you mean?
Yeah, the one.
You
the
can
one
ask from the store. There is a small
that-
rubber.
We want the rubber
Yeah, the
like
small-
this big, this black, this black.
Yeah.
we
You can
have,
ask
but
from.
you can give us like this.
You can ask from the store.
Because this one, it can, what you call this one, hit the skin, it will injure the skin, the one you with black.
Very fragile.
Did you ask from the store?
No, we don't know, that's why.
Yeah, there
we are
is for the
using
pediatrics.
improvise.
Yeah, there is for the pediatrics special small rubber for the pediatrics, single use only. You can order it from the system from the store. Okay, and pumping the fist should be prohibited. You should ask the patient to make a fist, just a fist, never pumping the fist. Why? It can cause muscle movement and change in blood, in some of the blood components, especially the lactic acid, because of the lactic acid inside the muscles. And when the patient moving the hand, the lactic acid will goes to the bloodstream, and the level of the lactic acid will be elevated, falsely elevated level of lactic acid. Yeah, what?
How do we do? Hey, Shada. How we struggle for them.
Regarding the lactic acid also, we should extract the blood without tourniquet, because the tourniquet will, without tourniquet. If you have a lot of blood tubes, you should extract it. The lactic acid tube is the last one. So you will remove the tourniquet before you extract the blood in the great up tube. Okay?
What is doing to
Falsely elevated level of lactic acid because of the lactic acid accumulated in the muscles. Okay?
But my question is, do they have this pediatric tourniquet?
Yeah.
Have in the store?
Yeah, in the store you can ask. Rubber, plastic, yeah.
The one we request.
Yeah, of course.
Even for the potassium, we are not allowed to do the squeezing. no?
Yeah,
Squeeze,
of
squeeze.
course. The
It will
potassium you
be
cannot.
hypercar-
Yeah. Will give us false elevated level of potassium.
Potassium.
Yeah. Also, my colleague will talk about the most common complications during the venipuncture. One of them, wrong order of draw, can cause high elevated level of potassium. We have correct order of draw. We should follow this order. If there is something wrong, the result will be affected, and sometimes the potassium level will.
It will become
Yeah,
sometimes
of
high.
course. Yeah, high level.
6, 7, but then
Yeah.
they will say, what is that?
This is the steps of vein palpation. How to palpate the vein. After you put the tourniquet, feel to locate the vein. Feel like this, by this finger across the vein, not like this. Then roll your finger to know the size of the vein. Is it small or? Yeah, also for the pediatrics. Yeah, many times you know. Then trace to know the path of the vein, and after that palpate to know the depth. Is it superficial or deep vein? Okay, that's very important. The vein palpation steps. Step number 7: skin disinfectant. Usually using the 70% isopropyl alcohol for the disinfectant. The venipuncture site must be disinfected with an antiseptic. Cleaning in a circular motion is highly recommended from in to out. Allow the area to dry naturally for 30 seconds to reduce the risk of hemolysis. Okay? If it is necessary to repalpate the vein, after I clean the area, I need to repalpate the vein. What should I do?
Clean it again.
Clean it again, yeah, of course. Never dry the alcohol with unsterile gauze or cotton, and never touch the site after cleaning it, and if I touch it, should I clean it again? Step number 8, tourniquet reapplication and needle inspection. If I need to reapply the tourniquet, waiting for 2 minutes. Reapply the tourniquet, be cautious not to touch the disinfected area, and tourniquet should remain for a maximum of 60 seconds to prevent heme concentration. Be aware that there is a few tests that must be collected without tourniquet, such as lactic acid, as I mentioned before. This is the step of venipuncture, or this is the venipuncture procedure.
Oh my God.
I think in the ward you are not using the Vacutainer,
Sometimes.
but it's better if the patient has more than.
Sometimes we have an endoscopy we are using.
Because we need always to fix the IV line. That's why
One prick.
one prick only.
Cannula at the same time, blood extraction.
But now we are
That's why
not.
we're not using
Mhm.
the
What's
Vacutainer.
easier than? The first step, ask the patient to make a fist. Okay? Use your non-dominant hand to anchor the vein like this. This is my non-dominant hand under just under the elbow, and the thumb just below the venipuncture site, and stretch the skin. And the dominant hand for the inserting the needle inside the vein. Okay? This is if I want to extract the blood from this area, and if I want from the metacarpal veins, I should ask the patient to make a fist, and I will stretch the skin by the thumb. Yeah, under the knuckle.
This is exactly what we are doing.
Yeah, okay. After that, hold the collection device in the dominant hand, I mean the closed system, the Vacutainer. The bevel of the needle should be facing up. Position of the needle above the vein, so it's lined up and paralleling to its path. When I know the path of the vein, I will put the needle like this, so I will enter like this, okay, parallel to the vein. Warn the patient before venipuncture for the antecubital side. Venipuncture in case between 15 to 30 degrees. If the vein superficial, I will decrease the angle, and if it's deep, 30 degrees. When the needle enters the vein, you will feel decrease in resistance, and flash or small amount of blood will usually appear. Hold the blood collection device, the holder, by the non-dominant hand, and changing the tube by my dominant hand, okay? Blood will begin to flow into the tubes. Blood should continue to flow until multiple tubes have been collected. Remove the needle and activate the needle safety features if it's needle safety devices, and discard the needle in the sharp container. Directly place sterile gauze over the puncture site. Ask the patient to hold the gauze or cotton and never bend the arm, which can cause hemolysis. If the bleeding has not stopped, the patient under anticoagulant therapy or something like this, the phlebotomist must apply pressure until the blood stops. What's the meaning of order of draw? And why should I follow this order?
Order of The drawing the blood.
Yeah, during the
first one, which
The
one
first
you will
one.
put like that?
yeah, you know the correct order of draw.
Yes.
Okay, why should I follow this order?
Because first aseptic technique, from like for example in the
Blood culture.
the first one you have to do the blood culture.
Yeah,
first,
of course.
okay?
Uh-huh.
Then you will follow the next one
Okay.
until it will be the
Okay, green or editor first?
No.
Sorry, green or green or editor?
green.
Green. Why?
This is
If I extract the editor before the green, what happens?
This one we don't know.
You don't know. Okay, I have two types of tubes:
Mm.
non-additive tube and additive tube. Okay.
Green, yeah.
The non-additive tubes means plain tube. The blood inside the tube similar to the blood inside the vein. This is the first tube should I extract. But actually we don't have the plain tube. This one, the yellow top tube, which we call it the plain tube, it contains clot activators to accelerate the clotting. Okay? So logically we should start by the plain. But I don't have plain tube. This one for, this tube for coagulation. And this one contain clot activator. So will affect the result of coagulation. That's why I'm using the blue top tube before the yellow top tube. Okay, so this is the first one, the second one, then the green, editor, and finally gray. Okay, so should I follow the order to prevent contamination of the anticoagulant or preservative from tube to another? Okay, if I'm using this one before the that one, the clot activator will affect the result of the coagulation. Okay, the blue top tube is the only tube should I fill it until the line. If it's underfilled or overfilled, the lab will reject the sample. You know, somebody knows why?
Yes, we know
Why?
that.
Why this is the only tube? The editor should I fill it 4 ml, but if I send the 2 ml, the lab will accept. Why they reject the blue top tube if it's underfill or overfill?
Because it is maybe over already additional blood.
If you check the tubes, all the preservative or anticoagulant in a powder state, except this one, liquid. So I need 1 unit of anticoagulant to prevent clotted 9 units of blood. 1 to 9, this is the ratio. Okay? If I collect less than this amount, so the amount of the anticoagulant more than the amount of the blood, so the sample will be diluted because it's liquid, not powder. Yeah. If I send it overfill, it will be concentrated and the actual result will be wrong. Okay? This is the very important point in the coagulation. The most sensitive tube in the lab. Okay?
Please, can you come again with this explanation? We didn't get it.
This one, these two.
This.
Okay, the blue top tube is the only anticoagulant should I fill it until the line.
Yeah.
Because of the anticoagulant inside this tube is in a liquid form, not powder.
Oh, okay.
And the anticoagulant in a liquid form and the blood in the liquid form also. So I need to keep the percentage of the anticoagulant to the blood. I need one unit of the anticoagulant to 9 units of blood.
So if it is over, it means over.
It's over, it will be concentrated. If it's less than or underfilled, it will be diluted sample and will give us false elevated level of coagulation test or false decreased level. Okay? So this is the correct order of draw. Step number 10, when I finish the venipuncture, I will discard the contaminated equipment by the proper way, or sharps in the sharp container, or in a biohazard bag, anything, gloves or cotton inside the yellow bag, and papers or something like this in the black bag. Step number 11, specimen labeling. The label should be in a vertically because of reading the barcode. Step 12, thank the patient. Step 13, specimen handling and transportation. How we send the samples from the units, different units, to the lab. Actually, my colleagues will complete how we receiving the sample inside the central lab, and after that how to separate it or distribute it in different labs. And that's all for
You did not mention the mixing. Of
the mixing. You know, you want me to, okay. This one, the first one, the powder and the anticoagulant or the preservative inside this tube is the clot activator. Any powder, I should mixing vertically, 1, 2, 3, okay, 6 times. This one,
6 times.
yeah. Regarding to this one, the liquid anticoagulant, for 5 to 6 times. 1, 2, because it's liquid, easy to mix. Okay. All the other from هذه كم 5 ل 6 صح؟ Yeah, I think 5 to 6.